Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, let us now learn some important points about hemangioma. So if you see, hemangioma is the most common benign tumor of the liver. Hemangioma is the most common benign tumor of the liver. This is most commonly seen in females and it is associated with oral contraceptive pill use. There are two types of hemangioma are seen. One, we have capillary hemangioma and second we have cavernous hemangioma. Okay. So one, we have capillary hemangioma and cavernous hemangioma. These hemangioma are actually the small tumors which are less than 5 centimeters in size. If they are more than 5 centimeters in size, then we call it as giant hemangioma. Then we call these hemangioma as giant hemangioma. Now what does these hemangioma do? They will increase in the size by ectasia. The hemangioma will increase in size by ectasia. Okay, so if you see the clinical features of hemangioma, these patients are usually asymptomatic and they are diagnosed by radiological investigations. They are asymptomatic and they are diagnosed by radiological investigations. Then if you see in symptomatic patients, you will see that the patients will have abdominal discomfort. In symptomatic patients, you will see presence of abdominal discomfort and abdominal pain is seen in symptomatic patients. Rarely it is actually associated with a syndrome called as Kasabach-Merritt syndrome. According to this Kasabach-Merritt syndrome, if you see the clinical features of Kasabach-Merritt syndrome, you will see presence of microangiopathic. There will be microangiopathic hemolytic anemia. In Kasabach-Merritt syndrome, you will see presence of microangiopathic hemolytic anemia. So, rarely you will see this is associated with a syndrome called as Kasabach-Merritt syndrome, which shows microangiopathic hemolytic anemia. This shows platelet trapping anemia. Okay, this also shows consumptive coagulopathy. Then it shows thrombocytopenia. So it shows microangiopathic hemolytic anemia, platelet trapping anemia, consumptive coagulopathy and thrombocytopenia. Now, how are you going to diagnose this? The diagnosis, if you see, hemangioma is a vascular tumor. Because hemangioma is a vascular tumor, you will have to FNAC or biopsy is actually contraindicated in hemangioma. Then what is the investigation of choice for diagnosis? Is actually MRI. In the MRI, you will see presence of peripheral nodular enhancements. So investigation of choice for diagnosis is MRI. Here you will see presence of peripheral nodular enhancements. Now if you see the treatment of choice of hemangioma is you should do enucleation. Thank you for watching.
Thank you and thank you for watching.